So September is Pediatric Cancer Awareness Month, and unfortunately millions of children around the nation suffer each year from various kinds of cancer. And every day, though, there are advances and new treatments to save these young lives. And Dr. Matt Ramirez joins us today to talk about some of those advancements and what's next. Good morning, and thank you so much for joining us to talk about this difficult subject oftentimes. Let's start with that good news, though, that I just mentioned there, that childhood cancers, they're rare and the survival rate is pretty high.
Correct. So as of right now, we're looking at about an 85% cure rate across the board for the childhood cancer diagnosis. Now, that takes into account some really good prognosis in the acute lymphoblastic leukemias, which are the most common types of childhood cancer, but also takes into account a very low survival in some of the brain tumors, and so that's where we get to the 85%.
Okay, and some of the newest advancements, I guess, that are working to cure some of those bigger, more common types. Can we talk about that a little bit?
Sure. So research, and more research.
Yeah.
So the way we've gotten better at curing kids' childhood cancer is through research, and of course research takes money, and so we're always in September trying to promote Childhood Cancer Awareness Month so that we can get more money to put into research to get more cures.
Absolutely. Some of the common ones that you just mentioned, what are the most popular ways that you treat such little individuals for such a big disease?
Sure. So the most common diagnosis is leukemia, and as of right now, chemotherapy is still the baseline, but through research we now have this new therapy called CAR T-cell therapy, where we now actually take T-cells from the patient, genetically engineer them, and put them back in the patient to attack the cancer without the need for chemotherapy.
Any chemo at all.
So we're hoping in the future, again, more research, that we can one day just do this procedure and be able to sidestep chemotherapy altogether.
That's awesome. You mentioned lymphoma, but are there any other really common types besides that? So
leukemia is the most common. Second is brain tumor, actually.
Leukemia.
So leukemia is, and that includes blood cancers, including like leukemia and lymphoma. But brain tumors are the next one. And so actually just a few months ago, really, they eclipsed. So we're doing so much better at leukemias that they're no longer the #1 killer of children. So we've moved that down, and brain tumors are now, since they were #2, now they're #1 as the most deadly type of childhood cancer. So now we're hoping that the focus can be put more on brain tumors to help pull those numbers up. Like I said, some of them are as low as 50%, and then there are some types of brain tumors that we can't do really anything to cure.
Is there a way to narrow down some of the biggest ways to look out for signs, or the way that a child, you come about finding it in a child?
Sure. So it's varied, obviously. Just like an adult, breast cancer doesn't present like colon cancer, but what we usually see is regular symptoms or signs that the family has kind of felt like went on too long, or the family was concerned that they weren't getting better like they usually do. So the good news about children is they should be healthy, right? So pain that is lasting longer than you should. They shouldn't have chronic back pain, right? Adults do, but kids shouldn't have chronic back pain, or a pain in the leg that doesn't go away. Fevers that don't seem to get better with the symptoms that a normal cold will. These kind of things that tend to go along further than they should tends to be a red flag in parents' minds, and bring them in either to the regular doctor or the emergency room, and usually there is where we kind of see, oh wait, something is a little miss, and we get involved.
Gotcha. Well, you mentioned fundraising obviously goes along with the research that is so important, and there is an event coming up that we can all possibly help out with? Well,
it depends if you like your haircut. I mean, if you like my haircut better. So St. Baldrick's is a foundation, childhood cancer foundation around the country, and their big fundraiser is around St. Patrick's Day in March. So we'll be having an event here on the 16th of March at Palm Beach Children's Hospital, and so that people have plenty of time to get brave enough to shave their head. But the idea is to raise money by saying, okay, I'll shave my head. You can even put a price and say, okay, for $1,000, if everybody in the newsroom brings $1,000, we raise $1,000, I'll shave my head. These kind of things. And so it's going to be, again, September 16th at Palm Beach Children's, but you have to sign up, and if you sign up, it'll tell you how to ask your friends for money to go to childhood cancer research.
September or March 16th?
I'm sorry, March 16th.
Right.
Sorry, St. Patrick's Day.
No, that's okay.
Around St. Patrick's Day.
We'll look forward to hearing some more information about that. Thank you so much, Dr. Ramirez,
Thank
for joining us today.
Thank you so much for having me.
Thank you.